Hi there, it's Nikki from Synergy. I just want to share with you a couple of key tips on how to optimize your breathing pattern. Now, the reason that this is important is if your breathing pattern is not optimal, it can give you things like neck pain, shoulder pain, headaches. If your breathing pattern's not optimal, it can affect your stress management and your stress response. It can also affect things like lower back pain and even your pelvic floor function. So really important to know how to breathe optimally. So if you can understand or imagine your diaphragm is your main breathing muscle, and your diaphragm is a little bit like the top of a mushroom cap. So if you imagine the top of a mushroom cap that sits just at the top of your belly or at the bottom of your lungs, and that mushroom cap, when you breathe in, that mushroom cap pulls down and it sucks air in through your mouth and nose, air into your lungs, and as you breathe out, the mushroom cap just naturally relaxes and recoils, a bit like a trampoline, comes back up, and your air just falls out. So when you breathe in, your diaphragm, or that mushroom cap, needs to pull down into your belly, and when you breathe out, it just naturally recoils. So that's what normally happens in an optimal breathing technique. Now, if you are someone that has really tight upper abdominal muscles, which is actually really common in women, right? We're so used to trying to hold our bellies in. If your belly muscles are too tight, what can happen is the diaphragm has trouble descending down into that abdominal region, which means the diaphragm doesn't work too well, and we end up breathing up into the neck, which can give us all sorts of problems through our neck and shoulders. So to optimize your diaphragm function, what I'd like you to try is, if you try lying down somewhere, it's a bit easier, or sitting leaning forward on your hands, but try lying down. You're going to place your hands just on your upper belly, and with your hands on your upper belly, you're going to let your whole belly completely and utterly hang out, which is for a lot of people a bit of a foreign concept. So let your whole belly hang out, and then when your belly's relaxed, what I'd like you to do is have a slow breath in, and you're going to let your belly expand into your hands as you breathe in. And then as you exhale, just let your belly soften. No force, you don't force your air out, just let it fall out. So let's try that again. As you breathe in, allow your belly to expand into your hands, and as you breathe out, just let your air fall out. So I call this slow, low belly breathing. You don't need to take a deep breath. Remember, a deep breath ends up in the neck anyway, so just make it a slow breath, but a low breath and not a big breath. So slow, low belly breathing helps to retrain the diaphragm to start functioning well, which can take pressure out of your neck, which can help your pelvic floor function because it works together with your pelvic floor, but can also help you manage some of your stress levels. So slow, low belly breathing is a really nice tip to be able to optimize your breathing pattern, and you can practice that in lying down is optimal, or sometimes in sitting, just leaning forward on your hands. I hope that helps you understand your breathing pattern.